Okay, so this one I think is a very, very important X-ray to look at. And I think too often people are looking for fractures and they don't really notice there's something like this. Very, very important that we look at this. And what you can actually see here is that we've got pediatric patient. Like we said before, we've got growth plates, and you can see the growth plates are there, there, and there. And you can see that the growth plates are very well corticated as you come closer and closer to the edges. So it looks a bit more white, a bit brighter as you come to the edges, because it's kind of always been like that. But remember how I was talking about trabeculation and bone texture. So what we're going to do now is zoom in to this area over here. I mean, you can see trabeculation, very nice straight lines all over the place, very nice straight lines all over the place. But over here, as you kind of go across, you can see that the very nice straight lines aren't so obvious now. It looks kind of cloudy, a bit murky maybe. And then when you look at the cortical edge over there compared to the cortical edge over here, this looks a bit hazy. It doesn't look quite right, okay? So you zoom in a little bit more and you can see very well defined, nice sclerotic edge. And maybe there's actually a little bit of an extra line sitting outside the edge, right? So that's one line there, over there, but like a double edge over here. So that must mean that there is some periosteal reaction. So when you've got periosteal reaction, you've got to start thinking about there's something more going on than meets the eye. You can have periosteal reaction in someone who's got a fracture. Sometimes you've got a fracture that's all the way down here, and then you've got periosteal reaction that goes all the way up the leg because the whole body is reacting, trying to fix itself. But this happens to be in context of this very, very abnormal area of bone texture that is sitting over within this region over here. You can't 100%, you can't see a definite communication with the growth plate, but as you kind of look closer and closer, you can see this kind of irregular, hazy bone texture that kind of goes all the way down like so. In the context of knee pain in a young patient, you have to be worried that this patient's got an aggressive process. At this point, that's all you can say, aggressive process. You could try and put a differential, and one would hope that it's nothing more than just maybe osteomyelitis. Maybe there's a Brodie's abscess, which is another version of osteomyelitis as it progresses further and further, i.e. infection of the bone. But you have to be careful because it could be anything. It could be Ewing sarcoma, osteosarcomas, all sorts of things. Very, very important that you appreciate the trabeculation of the bones and if there's any cortical reaction. Unfortunately, we've had a few cases where the cortical reaction at the very least has not been appreciated on the initial inspection, and we end up getting x-rays coming up further later down the line. And yeah, things have got a little bit worse, unfortunately. Okay, so this one hopefully is a...
I think there's a question.
Yeah, go on. Yeah, exactly. You've done it. Yes, osteomyelitis. This one actually, although it's completely correct to say osteomyelitis, this patient ended up having shoulder pain as well. They had more x-rays and they had multiple areas of similar looking appearance. And that is known as, I always forget, the phrase is CRMO. And I always remember it's like chronic, or CRMO. Let me just quickly look it up for you. Chronic recurrent multifocal osteomyelitis. And it's not necessarily infection that's caused it, but you can get multiple areas and can come at different times and stuff like that. So that particular patient had very similar appearances to their shoulder, actually. Okay,